there, Filipinos listeners and followers. Magandang gabi po sa inyong lahat. We hope you're all doing great. And as you know, Filipinos is brought to you as a public service project of the PNANV, or the Philippine Nurses Association of Nevada, in collaboration, of course, with our favorite radio station, PHLV Radio. So thank you very much for joining us today. Well, more and more, we are seeing the openings of ambulatory infusion centers. Ambulatory infusion refers to a type of medical treatment where patients receive infusion or intravenous therapy in an outpatient setting, such as in an ambulatory infusion center. These centers provide a comfortable and affordable alternative to hospital settings, allowing the patients to receive medications or fluids or nutrients directly into their bloodstream for immediate results. So today we have invited two registered nurses who have opened up their own ambulatory infusion center. So please welcome Mr. Christian Claros and Mr. Ron de Guzman.
Hello.
Hi, guys. Kumusta?
Maraming salamat.
Oh,
sa pag-imbita mo.
Thank you,
Yes.
thank you. We've been planning this for a little bit. So I have to let you guys introduce yourselves, right? Because you guys can talk more about what you did and where you're at. So Mr. Christian Claros here is the CEO of Immediate Infusion Center, right?
Hello. Kamusta? Little background about me. I've been practicing nursing for about 22 years.
Mm-hmm.
I started as a CNA at the age of 16.
Wow.
And then I graduated LPN at the age of 19. And step by step, I went and got my RN degree. Actually, I haven't told you this yet, but currently back in school for my FNP.
Oh, Lordy.
Very busy.
Very busy.
Yeah, so that's it. My passion is medical. Since I guess I was a little kid, I wanted to be a doctor growing up sa Pinas, and then immigrating to the U.S. This is as close as I could get to my dream. So
That's good. That's very good, and you definitely will do good with being an FNP. And Mr. Ron de Guzman here is the COO of Immediate Infusion Center. Hi, Ron.
Right. So I started loving computers when I got here from the Philippines. Siguro graduate na ako na high school at that time, and I feel like I enjoyed really programming at that time. But then, of course, the tuition is really high, and I said I need some kind of source of income to support my dream. So I became a CNA. So I said, that's the one that's going to give me the insurance and 24-hour, I can go to school during the day and go to work at night. Mm-hmm. And then I fell in love with it. And I did finish my computer programming and work, went up to the managerial position, but I missed the interaction with the patients. Mm-hmm. Mm-hmm. So it turned out that became my passion. Became an LPN, and then I became a registered nurse. And then I met Christian probably 20 years ago.
Oh, wow.
I was running my own group home, and he thought I was just caregiver.
I was a home health nurse then.
Yeah. He was servicing my patients, and then that's where our friendship started.
Yeah.
And
Very
then
good.
so now we're running this infusion center for how many years now, Christian?
3 years.
3
3
years.
years.
Yes.
Okay.
And those 3 years, we developed this system as we grow and say, all right, I'll take care of the IT, you take care of the marketing, and then we both are the third and the fourth nurse on the floor.
Uh-huh.
Yeah, it's
You
fun.
guys wear many, many hats, but I do know that Immediate Infusion Center is, very productive and very popular. And so kudos to you guys.
Yes, thank you.
Okay, so let's talk about ambulatory infusion therapy. What is ambulatory infusion therapy?
So
And you can tag team.
yeah, traditionally, right, a lot of infusions were done in a hospital or hospital inpatient setting. So pupunta yung pasyente, magstay doon overnight, and then they get infused or they get done whatever needed to be done. Ang difference is sa ambulatory infusion suite namin is it's an outpatient type. Right? Patient comes in, depending on how long their infusion is, 3-4 hours, sometimes an hour, and then they get to go home afterwards. So of course, even though na it's outpatient, we still have high caliber nurses, right? Meron tayong background with ICU, ER, and then couple of our lead nurses has 8 to 10 year background with infusion
Yes.
centers. So.
Yeah, what makes this place unique is because from the very beginning, we don't want it to look like a clinic. We don't want it to look like a medical facility. We want it to be like a living space where you can bring your kids, your family, and that's one of the things that we actually promote. That's why we have a kids table there where they could play. We have a what do you call that big seat right there?
Oh, love seat.
The love seats.
Yeah.
We have recliners, and those recliners are leathers. And the view is, even though we're in Vegas, the view will probably take you somewhere else. You forget that you're in Vegas.
Looks like an
Yes.
oasis.
Yes,
And
and I have been to their office, and I know where that love seat is, and I know the view. The view doesn't look like desert at all, so it clears the mind, and so it's a good place to be.
Yes.
Yes. So, what is the difference between home infusion and ambulatory infusion?
So with a typical setup with a home infusion, right?
Right.
A nurse would go to the patient's house, set up the infusion there, right? It's good, it's comfortable for the patient, right? Because they're at their own home. But the reason why it separates home versus a center is the safety efficacy of it. Meaning, I would have 2 to 3 nurses at my clinic, right? And then the patient would be taken care of like pretty safely.
It feels different when you're surrounded by professional nurses.
Correct.
Most of the time, if you are expected to be taken care of at home, you only see one nurse, and that one nurse needs to be kind of like you're it in a sense,
Tag,
right?
you're it, right?
In the ambulatory centers, aside from the 2 floor nurses that we have, like what I said, I'm in the background doing IT stuff. Christian is constantly on the phone. If ever that they need help on the floor, we're always kind of like ready to
There to help.
Oh yeah,
Yes,
and that's
yes.
what makes it fun because all of a sudden it's like, who's this new face? And then now we start talking to them and say, oh, these are actually the owners, and oh yeah, they're doing IVs too. So it's fun. Yeah.
And really, the patients relate to that very, very nicely. They can see that the leadership is helping, run the place. So that's really good.
Yeah.
And you just described the perfect ambulatory infusion center. So what do you think are the advantages or the benefits of coming to an ambulatory infusion center?
I think the biggest advantage of it is the feeling safe and still being surrounded by professional nurses. And also at the same time, this is one of the things that the patient is worried about is if they get a reaction, what are we going to do? We are surrounded by hospitals, University Medical Center and the Valley Hospital. So luckily, we have not sent
Anyone there.
a single patient
Right.
that reacted to a medication, but we are kind of like, we are very proactive with, the pre-medications that we have to provide just to be sure that if patient is sensitive to some medications that they are being given medications to kind of like counteract if the allergy reaction, the possibility.
Right.
So that's what makes the ambulatory center more advantageous to a home clinic, a home
Do you have anything
service.
to add to that?
Yes, actually, yung ibang pasyente ko, to be honest, would tell me, I love coming into your clinic because sometimes that becomes their mini vacation. out of their own home, right? Because some patients say, I'm stuck in my house for this long. Because we cater to a lot of autoimmune diseases, right?
Right.
Some of them have myasthenia gravis, multiple sclerosis, lupus, and other immune diseases. So them getting out of their house, getting to look at the view where they sit at, their own, what do they call this? Private suite, recliner chair and TV. For them, it's like vacation.
It's a relaxation phase.
Oh, yeah.
Yes,
for them.
and that's what Ron said, kanina. We make the setting not clinic-like, right?
Yes.
It makes like an extension of their house in a sense, with professional nurses around them.
Yeah. And they can make their own schedules
Yes.
too, right?
Right. Our schedule is open, meaning if we get the medication now, if you can come in now, we'll infuse you now. We have that's the beauty about having so many nurses on the floor. It doesn't limit us from kind of like, all right, we can double book, triple book, but sometimes patients' schedule is just not flexible enough, and we
Right.
have to cater that and say we can always say right away, come in and we'll take care of you.
Yeah, it's
Yeah.
kind of like, I can't come at 2 o'clock because I have a bingo appointment,
Yeah.
right?
There you go. Exactly.
Yeah.
Some of them does.
That's important.
Yeah, that's true. That's very important. But also, I think it's more cost effective, isn't it?
Yes.
Rather than the hospital-based or other type of
Oh,
facilities.
definitely. This is the reason why we came up with this name, Immediate. Actually added an E, and then it sounds like we need it now.
Immediate.
Immediate. You pronounce it immediate, but it's actually immediate. This is actually to keep the patient out of the hospital. We ended up in the middle and then we actually provide a lot of advices, being that we are all, most of our nurses are all like very, very veteran with what they do.
Yeah.
And so we don't just kind of like talk about their condition, we talk about life, we talk about family, their kids. And this is what makes another reason for why they love coming back.
So that is indeed your mission and your purpose of why you built your ambulatory infusion center, right?
That's what makes us go, keep the doors open, because this
Yeah.
is we're doing something really special here.
Yes.
Yep.
Very good, very good. So what are the therapies that you administer?
So we do a lot of biologics, going back to the autoimmune diseases. We do as some types of medication, IVIG, Remicade for GI, some medications like what do you call this? Skyrizi, the new ones, Tremfya. I'm trying to see if I can plug the drugs. I'm giving them free. So, yeah, and then what I like about those drugs is you see them come in at their worst time, and then once they get infused, you see them get better, right?
Yes.
And that's what I cannot, replace. When I see them come back the next week, 3 months later, I'm better. I'm walking, or I don't have stomach pain and all that kind of stuff. So there's a lot of patients in the beginning that would feel, unease or natatakot sila, right? Because they don't know what biologics is. But then again, with knowledgeable staff that we have, nurses and front staff, we make them feel comfortable.
You make them feel comfortable. You do iron infusions as well,
Yes, you're right. Thanks for
So,
reminding us.
Yeah,
Sure.
the iron is kind of like our feelers, right? They're only there for maybe like 2 sessions or 5 sessions. What makes that special for us is that because now we are like the middle age, kind of like women, comes into then they're in a very a sensitive, a very important part of their life. Sometimes they'll bring their the other kids, and then the husband, and that becomes like a family tour. And that's why if we can keep them so comfortable, then they're gonna keep bringing their kids here, and that's nice. That's why we want this is exactly our vision.
right?
Is we want this to be like a family tour, not like a service for something that you need. Imagine a patient or a client needs an IV, needs to be poked now, needs a needle prick that they never had before. So how do you turn this around and say, "Oh yeah, this is gonna be a fun thing," you know? And then they just gonna keep coming back. And that's our mission: is if we can get to that on a personal level, then I guess we did our job.
Yes, yes. So aside from the chronic diseases with immune, the iron is usually used for pregnancy, like for when their iron levels tank, the pregnant women.
Yeah, usually during their pregnancy, their iron levels go down. This is a good boost for the body to actually promote, to stimulate, to make more blood, especially for the baby and the mom when they deliver the baby, and that's when they expect you might lose some blood. So it's like a preparation for something that is expected.
Yeah,
in a way.
Since the baby is sucking up all the
Yeah,
iron,
That's
right?
right.
Yes. Okay. Yeah, and that's it's a very popular therapy these days. So you mentioned a lot about biologics and specialty medications that you administer at the centers. One of the therapies that you also administer, which is also in your website, is hydration therapy, right? So why is hydration important? Why choose IV therapy?
So as we know, well, we're in Vegas, especially summertime. Everybody gets dehydrated. That's one thing, right? So we also offer the hydration therapy on the side, on the other side of the biologics, because majority of our clients, again, would request for it. So that's what the need, started, and then we just the wellness side just blew up. It entails simple hydration, normal saline. Somebody that's just say, I feel dehydrated. I haven't been drinking water. Can I get a liter, right? To as extensive as NAD plus for anti-aging, glutathione for skin glow, right? A lot of Filipinos, mga Filipino, di ba, mahilig magpaputi. Gusto glutathione. I have a lot of customers or patients, right, clients, na nag-infuse, but just parang educational lang. Parang we as an infusion center, we push glutathione for liver detoxification, not just skin whitening. That's what I usually push it for, because yung sa amin is not for beautification to start with. We're trying to hit yung wellness side ng pasyente.
The wellness side of the
patient. And we can handle simple like migraine infusion, jet lag, or hangover. We do all those kind of stuff.
You do all
as
that
well.
too.
Yes.
Okay.
In fact, nagkakaroon kami ng unexpected clients because when, let's say, somebody who's pregnant, who's there for an iron infusion because they were referred, and then they start reading the pamphlet and say, "Oh, my mom needs this. My mother needs this."
Yes.
And next thing you know, it's like family members start coming in with the actual patient and say, "Can I have this?" It's like, "Of course." And some of them, of course, like what Christian is saying, is we're in Vegas and we have construction workers that works during the day. We have those kind of clients that comes in like after work. It's like, "Oh, I need hydration." Yes, definitely you need hydration. And a bag of fluids does a lot of things.
Does a lot of things,
Oh, yes.
right? Absolutely, and I totally agree.
Yeah.
So, all right. So, where do your orders? I'm sure as giving IV therapy, you need to have orders. So, where do your orders come from? And do you work with a special pharmacy or maybe perhaps a primary prescriber?
So orders comes from different types of clinics, different types of specialty, ranging as simple as OBGYN for irons, GI for all those gastro issues. We deal with rheumatology, neurology. Now we're starting to dive into dermatology.
Derma?
Dermatology,
Wow.
yes. There's a lot of biologic needs for it, like your dermatitis stuff, right? Your eczema, that's not getting better. We deal with ophthalmology, and we also started going to visit primary providers for osteoporosis medication. Iron as well is getting pushed for CHF patients, congestive heart failure clients.
Right. So you're talking about ophthalmology. You're talking about like maybe Tepeza, or
Yes, Tepeza,
the one where your eyes are bulging and you need,
Exophthalmos.
exophthalmos, that type of situation. Do you do anything for post transplant?
We do deal with, you're right, a lot of kidney patients. We are we're partnered with NKDH, right?
Mm-hmm.
And then we see patients coming from KSOSN as well. So they're one of the two referring clinics. There are two big kidney specialists in Nevada. So we get patients from them, majority iron patients or biologics for...
Or biologics,
Yes.
right.
So that new transplanted kidney would not get rejected by their body.
Okay.
And in fact, the iron is also being given to kidney patients.
Yes.
For kidney transplants, and this is kind of like to protect whatever they have left, whatever they're dealing with. But the good thing about the immediate infusion center is we are now being some of the medications that just came out of the market. We are the first ones to give it. A very good example of this is the diabetes medication, what we call the Tzield. Very expensive drug, and most of our clients there is like what, teenagers?
8 and above.
8 and above.
So it caters to a younger,
And
clients.
And believe it or not, majority of our clients are kids,
Yeah.
children.
For the diabetes
Yes.
medication?
And
wow.
this medication, just for information purposes, like it kind of like delays the progression of the condition.
I see.
It does not cure it. It
It
delays
does not cure it.
Yeah.
It just
Yes.
delays it or puts it on a status
Kind of like
quo.
delays it, and
Yeah.
hopefully that this is a medication that would actually progress into something more
Cure it.
Yeah.
yes.
later on.
That's
It's a
the hope.
start.
Yep.
It's a start.
Yeah. There's so many things that are new these days. So many biologics coming in. They're really expensive. So I guess getting the medications at an infusion center is probably a lot cost effective.
Very challenging, especially those who doesn't have a lot of money to actually invest in their own health.
Right.
This is where our job or our business becomes really shines, because this is what makes it really worthwhile doing it. Some patients doesn't even have enough to pay their copay. We have programs for that. We will search for a foundation to find someone to cover your copay.
Help with the copay.
And if
Copays.
ever they don't have, the insurance is not covering it, we find ways. We kind of like become hand in hand with the patient, get them involved with their own care, and that's what makes this really special. And that's why I love, we have to keep this thing open and
Yes,
going.
absolutely. Absolutely. So how many chairs do you have, and how many patients do you see on an average every day?
So we have multiple rooms. 2 rooms are like the biggest rooms will cover 3 patients at a time. We have 3 reclining chairs.
Right.
So those kind of rooms, we have 2 big ones, and then the rest are private rooms. These are the ones that it might take a 3 to 4 hour infusion. Sometimes they will work while they're getting infused, and so they
Yes.
need privacy. And sometimes they will bring their family with them, and they want privacy, so they have that option. So we have 3 regular rooms, private rooms,
Yeah.
2 big rooms, and then we also have now 2 big rooms with the hospital
Hospital
bed.
bed.
We're preparing ourselves for a blood transfusion.
Oh.
That's the third phase of the
That's
business.
new.
Yes, that's
Yes.
Yes. Just secured a contract with Vitalent.
Yeah.
Oh, okay. Okay.
Blood services here in Nevada.
Blood
yeah.
services here in Nevada. Very good, very good. So I know you mentioned you have registered nurses working for you guys. What other staff do you have in the office? And you do have a medical director, right?
Yes, we do.
Yeah, that's Dr. Shazad, Ashir Shazad. Very nice doctor. I think he's an infectious disease.
Infectious
Disease,
disease
right,
specialty,
right.
yes.
And then we have a front desk, and that, like what we said before, we are RNs, but we do multiple
tasks.
Yes,
Right.
and then that's what makes everything. And now it's becoming like a family business, because my wife works there. Chris's wife works there now, and so this is becoming
know.
really yes.
Very good.
So this is turning out to be like a family thing, and that's what we want.
Yeah.
Yeah.
That's true. So I understand that your billing and follow-up services are outsourced, right? Can you tell us about that, and why did you choose these services to be outsourced? And you're outsourcing in the Philippines, right?
Yes.
Okay, very good.
So we have actually two teams different in different places. One is in India, Pakistan, in India.
billing.
For
For
billing.
billing?
Yeah, that's not our expertise, so we have to outsource that. And then we have now we currently have 5, but we're hiring another 2 that works at home back in the Philippines.
Remotely, right?
Remotely. And that's the beauty about it, is now we're extending our help. We can assist people in the Philippines, and we're looking forward to expand.
That's fantastic.
Oh,
That's
yes.
really good. So I wanted to bring that up because I know you guys, we're all Filipinos
Yes.
here, and we try to help way back, in our country. So that's good.
That's the goal, to keep expanding it there, right? Kasi ang daming Pilipino, masisipag, madatalino.
Yes.
Kaya yung mga staff na hinahire namin doon, majority of them nursing background, pharmacist, physical therapist. Sadly lang, yung disclaimer, yung salary, yung pagkakaiba between nurses doon na binabayad ng mga hospital versus what we can offer them is higher. So, of course, kung nasa Pilipinas din ako, ba't pa ako magtrabaho sa hospital, nakatabi ko kung may magbayad sa akin naman,
Yeah,
I think,
yeah.
one thing is I'm gonna say, para sa mga nurses sa mga Pilipinas, yung mga hospital, you guys gotta raise up the bar sa pay, right?
Right.
They deserve it. The work is very hard, emotionally and physically. So I think a lot of Filipino nurses, or even anyone in the healthcare field sa Pilipinas, needs to be paid more.
Yeah, that is a challenge, and I think there is a movement going on to try to raise the bar for that. So we can't cover all of
You're
that
right,
today,
I know.
but
Maybe next one.
maybe
I have
next
no-
time, right? Okay, so how is immediate infusion center? How do you think it is different from other ambulatory infusion centers in our area here?
Yeah, so siguro simula ako, dugsungan mo na lang. Sa akin, I think the different, yung masasabi ko sa akin kasi any infusion center can say, we love our patient, we care for our
Right,
patient,
sure.
right? And ang difference namin sa iba is, kami talaga, ang una naming priority is pasyente, right? Most of the time, nagjo-joke ako when other businesses or other people comes to the clinic and says, oh, ang lakas yung kumita. Sabi ko, no, we're decent, right? Because we cater to a lot of patients that need help, that patients that can't pay, right? So, ang sa amin, ang main goal namin is tulungan mo na yung pasyente bago kami kumita. Ron knows that, and I think that's one of the reason why it's working so well, kasi pareho kami ng understanding ni Ron when it comes to patient care. Pasyente muna. Hindi kami nag-usap about money, we don't talk about anything.
Right.
Main goal, keep our doors open so we can continue servicing yung mga pasyente namin.
Let me give you a quick scenario where ang pasyente, for example, meron silang insurance na doesn't want to pay for the medication. What makes us different is the fact that kami na yung huli niyong kakausapin. Meaning, if we gonna go through a problem, we're gonna go through it together. And that's what makes this different. Kasi it's very, nga lang talaga, masyadong mistrust talaga involved.
Very stressful.
Yes.
Right.
But if we, and that's one of the problems with a lot of patients, they're not so involved with their health. They only know that some of them would actually tell us, this is your job. You're supposed to do it. And my response to that is, but this is your health.
It's your body, right?
It's your body. Now, I'm not going to argue with you if it's my job, but my job is to get you involved. Why don't we call your insurance together? Because you have a louder voice. And that's what makes us unique, is because we make sure that we provide we become an advocate at the same time. Let's work together, patient and us, to get your medication. And the funny thing about this is that most of this we don't even get paid on the service. It's the pharmacy that makes the money on the medication. But hey, if you can get the medication to us, if we have to provide the service for free, we will.
Yeah, and my hat's off to you for that. I know as nurses, we don't really care much about the money part because somebody else is taking care of it.
Yeah.
So I guess that's where we are all coming from.
Yeah, exactly.
That's where we're all coming from. So where is the location of your center?
So we're very central in the valley. Rancho and Alta is our main cross street. The address would be 501 South Rancho Drive, Suite I-62. It's very accessible to the freeways, 95, 15,
Yeah.
even side street. Rancho is like a freeway now.
We
So-
are, like what I said, we are like 1 minute away from from UMC,
Yeah.
University Medical Center, and 1 minute away from Valley Hospital, and we are at the center of the busy area for
Medical
this. And
district.
For that,
Yeah.
right.
Mhm.
So again, for the audience, their center is located, Immediate Infusion Center is located at 501 South Rancho Drive, Suite I-62, and that's Las Vegas 89106. And if you want to give them a call, their phone number is 702-268-8648. Right? Did I get that right?
8647 actually.
8647.
47.
Yes.
Was that the
think that's
fax
a-
number?
That could
That's
be a
an old
fax
one,
number.
yeah.
the old
Oh,
fax
that's an
number.
old one. Okay,
Yeah.
so 8647.
Yes.
Okay, you can also go to the website, which is
Immediateinfusion.com.
immediateinfusion.com.
Yes.
Okay. All right, well, so how do you see the future of infusion centers?
I believe when it comes to the design of it, I think majority of it will be going to an outpatient clinic, right? Because
Right.
katulad na pinagsasabi kanina, saves time for the patient, not going to the hospital, long wait times, saves the insurance's money, instead of them paying the hospital 10 times. It's cheaper just to go to the infusion center with high caliber nurses or high caliber care. So it's gonna blow up in the next 2-3 years.
Yeah.
Yeah,
Yeah.
definitely.
Ang maganda kasi dito sa ginawa namin, nagsimula kami sa biologics, something like a referral basis. But then now, since families are welcome, they started to realize they need hydration. They need not only for beautification, they need something to protect their liver.
Other treatments,
And
right?
kidney, and then some of them would have questions regarding their health, and they didn't realize that there's medications for it. And the way I see this is what it's turning out to be is like I think we're gonna expand some more. Like what I said, we are now trying to get into blood transfusion. And the main goal here is to keep the patient away from the hospital.
Right.
If we
Right.
can do that in any way we can, we will do that.
Yes. Very good.
Yes.
Anything else to add to that?
Yeah, just to add, we're partnering up with a lot of other centers in the community, right? We're partnered with Safe Harbor. Yeah, it's a
Okay.
FQHC
Right.
clinic. We are partnered with Bridging the Gap. Those are the ones that have sickle cell disease. That's like the group, right?
Yes.
And what we give back to the community is, again, the assistance and some free services. Because some patients don't want to go to the hospital. We'll open our door for them to get as simple as the hydration stuff.
Yeah, and the knowledge that you impart also to the patients from a nursing standpoint about,
Yes.
yeah.
That's very important. And
That's
then
very important.
Yeah, and most medical facilities, when even the hospitals, when they get discharged, they feel like they don't know what to do.
Yeah, for sure.
Even just with medication prescribed to them, they don't know when to take them, how many times that. They need assistance from nurses like us, and believe it or not, Filipino nurses are still number one.
Of course. Yes, that is a given. So what is your message to the community about ambulatory infusion centers or IV therapy as a whole?
This is our outlook. We started, Christian and I, when we started this, we realized how important this center is, meaning we are providing service that opens up our eyes for mostly for these chronic illnesses. And if they don't get this medication, their symptoms get worse, and to the point where they can't function anymore. If we can be part of their lives, where we can continue the care and prevent them from progressing into something worse, that in itself is kind of like, you can't put the value on that.
Right.
That becomes our legacy in a sense. Like,
Right.
Yeah.
you know, like I always tell people, I'm not going to be a hypocrite saying I don't want to make money, but that's not the main goal. Now, the main goal is now take care of this client, right? Make sure they breathe, make sure they can walk, make sure they can eat, and then I go home happier than getting $1 million.
Yeah.
I go home and tell my kids, I help people today.
Yeah.
So it's been an up and down journey. You know,
Right.
it's not
Yes,
easy.
it's not
Me and
easy.
Ron, we don't
No,
have
it
business
is not
background,
easy.
so it's been a learning
Yeah.
and experience. So
And we're thinking about expanding this to the Philippines also.
you're right.
Oh,
Yes.
that's
Yeah.
awesome.
Yeah. If we
Let
can
me
do
know
that.
when you go there.
I know.
Okay, well, thank you so much, Christian, Claros, and Ron de Guzman, for coming
Thank you, Doris.
to us today and explaining what ambulatory centers are all about and how they operate. And given what you have told the audience and us, we really appreciate what you do for the community and for our
Yes.
kababayans also
Oh, yes.
in the
Yes,
Philippines.
definitely.
Thank you for having
Pleasure.
us.
Oh, you're welcome. You're welcome. And to our audience, we leave you with this. Ambulatory and outpatient infusion centers offer a superior alternative for specialty physicians dedicated to delivering timely, patient-first care. Instead of referring the patients to hospitals or other facilities, providers who choose these ambulatory centers ensure access to expert clinical teams, a broad range of infusion therapies, and a comfortable, convenient setting designed around the patient experience. So patients benefit from flexible scheduling, allowing them to select their appointment times that fit their lives. And additionally, these centers typically offer lower costs than the hospital-based options, making the treatment more accessible and affordable. So in essence, ambulatory infusion centers deliver a more efficient, cost-effective, and patient-centered approach to infusion therapy, enhancing the outcomes and elevating the overall experience. So thank you very much for joining us today. Please be safe and be well. Until next time, this is Doris Bauer, your Philippine Nurse host, signing off for now.
Just like a friend from back home.
This is your Filipino radio experience in Las Vegas. PHLV Radio.